building up bony tissue. Every day you are tearing down and building up bony tissue. That's called bone remodeling. You get a brand new skeleton about every 10 years. It takes about 10 years, but all the tissue, bony tissue in your skeleton is refreshed or renewed with new tissue. Deposition means adding bony material. Deposition means adding bony material. Resorption means removing bony material. Resorption means removing bony material. What do osteoblasts do?
They remove.
Deposition. What do osteoclasts do? Resorption, yeah. So we're constantly tearing down and building up bone. We control remodeling a couple different ways. With hormones, we just talked about that. You guys know that. We also remodel bones in response to stress. We also remodel bones in response to stress. If you put more stress on bones, they get thicker, they get bigger. If bones have less and less stress, they break down, they go away, they disappear. So if you're just sitting on the couch doing nothing all day long for an extended period of time, you lose bone mass. Bones get weaker. Your body, again, is a very much use it or lose it proposition. Now, there's a pretty cool video here that shows this stuff. Watch this. I've used this one several times before, it's pretty good. Remove, Doug.
The skeleton changes across the human lifespan. This is characterized predominantly by bone formation and growth throughout childhood, followed by a gradual loss of bone density that begins in early adulthood but can accelerate significantly in older adults. The density of bone is modulated by a group of cells including osteoclasts, which are multinucleated cells that resorb bone, and osteoblasts, which refill the resorption cavities created by osteoclasts. Osteoclasts anchor themselves to the surface of bone. This creates a microenvironment underneath the cell, which is referred to as the sealed zone. Within this zone, the osteoclasts create an acidic environment that dissolves the bone's mineral content. Once the mineral content of the bone has been dissolved, enzymes released from osteoclasts remove the remaining polygenic bone matrix to complete the process of resorption. Following resorption, osteoblasts move into the resorption space and start to produce and deposit organic matrix called osteoid. Osteoid, a substance made predominantly of collagen, forms a scaffold in which minerals including calcium and phosphate begin to crystallize. Some active osteoblasts become trapped within the matrix they secrete and thereby become osteocytes. Other osteoblasts will undergo apoptosis or will revert back to lining cells which cover the surface of bone. This cycle of bone resorption and formation is referred to as remodeling. There is also a process where bone formation by osteoblasts occur without prior bone resorption by osteoclasts. This results in an increase in bone mass and is referred to as bone modeling. Bone modeling promotes the growth of bones and is important for maintaining bone strength. Remodeling also plays an important role during bone growth by optimizing the bone structure.
bone is this? Spongy bone. Tuberculate, blood vessels all going through it.
After the age of 30, most people experience a gradual loss in bone mass due to a relative decrease in the activity of osteoblasts compared with osteoclasts. However, there are many factors that impact the process of bone remodeling and influence the degree of bone loss we experience as we age. For example, medications such as glucocorticoids, which can promote osteoclast activity and also reduce bone formation. Proper nutrition and physical activity can help strengthen bone. It is also believed that osteocytes form a complex network in bone that can sense any increased workload on the bone and respond by triggering the differentiation and activity of osteoclasts to increase bone density. Conversely, when bone experiences reduced loading conditions, such as during long-term bed rest, resorption and remodeling increase to eliminate underloaded bone. Loss of bone mass reduces its strength and increases the risk of fracture. This highlights the importance of staying active, maintaining good nutrition throughout life, and being aware of personal risk factors associated with low bone density.
Make sense? Everybody okay? How many guys thought that was pretty cool?
Yeah.
I think that's a real good visualization. When I looked this up, I scrolled down a little bit because I would like to see what's popping up on the front page, and I saw this, bone remodeling and microgravity. I have not seen this. It sounds pretty cool. Wanna watch it?
Yeah.
The bones in our bodies are alive, growing, and changing all the time. Our bones are composed of different layers. The outer surface of bone is called cortical bone. This is the smooth, hard part of the bone that we can see when we look at a skeleton. Inside the cortical bone is the trabecular bone. This type of bone looks like a sponge and helps to protect the bone marrow. The constant process of bones growing and changing is known as bone remodeling. This process is carried out by specific cells in our bones. Cells called osteoclasts have the role of breaking down our bone and removing any parts that need replacing. At the same time, cells called osteoblasts have the job of making new bone and helping to repair any parts of the bone that have been damaged. On Earth, in healthy individuals, this process is normally balanced so that the same amount of bone is made and broken down. In space, astronauts are exposed to lower levels of gravity than on Earth. This means that they have less mechanical stress put on their bones as they move around. Scientists believe that the bones naturally try to adapt to this new environment by increasing the rate that the bone is broken down by the osteoclasts. Meanwhile, bone formation continues to occur at the same rate as it does on Earth. The result is an imbalance in bone remodeling, which leads to an overall decrease in bone mineral density. While in space, astronauts can manage with lower bone density, but when they return, their bones are less able to cope with Earth's gravity. This increases the risk of fracture and injury. Scientists use many different tests to measure the density of the astronauts' bones. Results show that the astronauts, while in space, lose bone in a similar pattern to people on Earth who suffer from osteoporosis, but the astronauts lose it at a much faster rate. Scientists have found that exercise, when combined with good nutrition and increased vitamin D intake, is able to preserve some of the bone that was previously being lost. Since 2008, astronauts have been able to use a new exercise machine called the Advanced Resistive Exercise Device, or ARED. It is thought that this increase in force triggers the formation of new bone, bringing more balance to the bone remodeling process and allowing the bone density to stay at roughly the same level as it was before the spaceflight. It is a significant achievement to be able to maintain bone density in space, but more...
By the way, just take a look at this. I'll freeze it to give you guys a little more time to look. This is all the spongy bone inside the vertebrae. Look how much less is here. This looks almost like a spider web. This is still pretty solid. This is a vertebrae. So if this crushes, you have a bad day.
Experiments need to be carried out to see whether the new bone, which is formed in space, has the same structure and strength as new bone which is formed on Earth. Understanding bone loss associated with microgravity may lead to better preventive care or therapeutic treatments for people on Earth suffering bone loss as a result of bone diseases like osteopenia and osteoporosis, or for patients on prolonged bed rest.
All right. That was kind of cool. Nothing earth-shattering. Still kind of cool. So that is bone remodeling. Everybody okay? Pretty good with that? Next up, fracture repair. Some guys have broken a bone. Guys had to wear a cast for a while. So we took the cast off, it was still kind of smaller, didn't it? Especially a big old leg cast. That's because you lose muscle tissue, you lose bone tissue when it's inactive like that. When you break a bone, it starts to bleed. Remember, bone is very vascular. Take a look at page 191. When you break a bone, you break blood vessels and they start to bleed. That's formation of a fracture hematoma. Hematoma is a mass of clotted blood. If you didn't know that, write it down. Hematoma is a mass of clotted blood. So you form a blood clot. Because they don't have an oxygen supply, the bone cells in that area die. Because they don't have an oxygen supply, the bone cells in that area die, and it hurts. You've broken a bone, you know it hurts. How many guys broke your big toe? Anybody? Well, let me tell you, when they break your big toe, the first time I broke my big toe, I went to a doctor and they said, oh, cool, nothing we can do about it, take the other toe. The next 2 times I broke it, I had to take it to the toe myself and save the toe pain. So if you break your toe, you might not have to go to the doctor, but I'm not a doctor, don't listen to anything. So, formation of a fracture hematoma, you get a clot. Then the healing process starts. You begin with formation of a fibrocartilaginous callus. Because this is healing, granulation tissue forms. Because this is healing, granulation tissue forms. Fibroblasts and chondroblasts move into the fracture area. Fibroblasts and chondroblasts move into the fracture area. What are fibroblasts going to make? Fibers, collagen fibers. What are chondroblasts going to make? Cartilage. So together, these guys form the fibrocartilaginous callus. Fibrocartilaginous callus is a lump of tissue that knits the bone together. It's going to hold the 2 pieces of bone together. By the way, fibrocartilaginous callus is also called a soft callus. So that kind of knits the bone together. Once that fibrocartilaginous callus is formed, it begins to transform into spongy bone. Within a week, you start getting osteoblasts there. What do osteoblasts do? Make bone. So within a week, you're turning that soft callus, that fibrocartilaginous callus, into bone. That's called a hard callus. Bony callus, bony callus. That bony callus eventually becomes spongy bone. Cements the pieces of broken bones together. Then over time, bone remodeling occurs, and your bone's pretty much back to normal. You get compact bone layer over the spongy bone, it reshapes, and comes back to normal, pretty close to normal. all those pictures and all these steps are on page 191. Take a look at page 191 in your book if you're not there already. Okay, the hematoma or a clot form a soft callus, then a bony callus, and then you have bone. Does that make sense to everybody? Doing all this repair stuff in this video. Have you guys actually seen videos of orthopedic surgery, like knee replacements and hip replacements? It is positively medieval. They are wailing on their patients with hammers and drills and all kinds of funky stuff. It's pretty impressive to watch. If you get a chance sometime, check it out. It's almost scary. That's one of the really scary ones when they put that down into the femur. I mean, literally hammer, pound, pound, pound. Yeah, that person was jacked up big time.
When they put that medical equipment in like a medullary cavity, doesn't that disrupt the bone in any way?
I mean, it's normally just full of adipose tissue.
That's true. I mean,
So-
don't carry more fat.
Yeah, I mean, that's, us being Americans, we're good at carrying fat in other places.
That's true.
Yeah.
The one for the femur, is that for when, like, they broke their femur?
You mean the long one?
Yeah.
Yeah. That was there were a couple breaks in the femur there. And then you saw the hip replacement thing. Yeah, that stuff is just positively medieval when they're doing that stuff. Does anybody have anything like that in them you wanna talk about? You don't have to. But, no, I'm pretty much plague free. All of my breaks healed without the help of plagues. But that's pretty interesting stuff.
They have the place on the outside, doesn't change bone formation or remodeling.
I don't have a good answer for you.
It's not really.
What I imagine, total guess, I'm totally making this up as we go along. If it's, on the outside, bone's gonna come up and it's not gonna cover it.
Right.
But it's gonna kind of form around it. You put something in a tree and the tree grows around it, it's gonna end up looking something like that, I would guess.
I'd love to see that on film.
I have seen some pretty interesting skeletons. Have you guys gotten the chance to see the bodies exhibit at all? It was traveling around, There's a couple museums that have some of them, and there's one that was traveling around. The German one, the guy has impeccable documentation and provenance, all the people donated their bodies. The Chinese one, we don't know where we got these bodies from. But, they show skeletons, they show muscles. One of the really impressive things was, they had a display, they take human tissue, real tissue, and they preserve it, and it's almost like they plasticize it. And it's right there in front of you, they slice them up like pancakes, and you can see the people all spread out, and all sorts of really funky stuff. But they had this one that was a skeleton and human musculature like this, and they're both kind of dancing with each other. And what it was they had the guy's skeleton and his muscles, like this, dancing with each other. And you could tell from the skeleton and the muscles that the dude had suffered a serious crush injury a while before he died. I think it was the right side, I don't remember the details anymore, but he had, big, poorly healed fractures on his leg and on his right side of his arm and stuff like that. And the musculature on the right side was atrophied. You can tell he wasn't using his right side very much. His left side was okay, but his right side, it was, it wasn't last week, the bone had all healed, but they had healed wrong, they weren't set right. If he's out in a rural province in China, he might not have had access to the best medical care, he might not have had enough money, not enough access to the best medical care. I'm not sure how exactly they got his body, maybe he donated it, maybe he didn't, we don't know. But, if you ever get a chance, see one of those exhibits, it's pretty amazing. Emily, you had a question?
I was just like, what happens if a kid breaks their bone? Would
They heal pretty fast. Kids are pretty resilient. Now, if they break it at the epiphyseal plate, that's the growth plate. If they break it there, they have to be careful. They'll screw it back together and take extra care, because if the bone stops growing because of damage there, kid's gonna have a shorter leg or a shorter arm. That bone won't grow any further. So they have to be careful. But, kids breaking bones, that's when I broke most of my bones when I was a kid, so it's not a big deal. Put your cast on, okay, go play in the yard again.
I was just wondering, cause I broke my femur when I was younger, but I had to get put into like a whole body cast.
Okay, they probably multiple places?
I don't know.
Did they break multiple places? I would guess.
I slipped and fell on the kitchen, so.
Alright, yeah.
I was like 5.
It may have been multiple places, maybe they wanted to, it's kind of hard to tell a 5-year-old not to move around. So maybe it was more like to help immobilize you so you didn't put stress on it. I don't have a good answer why they did that, but I guess they know what they're doing, you made it.
Yeah.
You made it, so that's good.
How long does those get and stuff last?
Again, I don't know the stock answer off the top of my head. I wanna say 20 years, pretty much. I've had relatives with, knee replacements. And that's about the time frame that they give them. If you do it at 40, you're gonna do it again sometime in your life. If you do it at 65, probably not gonna have to worry about doing it again, kind of thing. But, some of those appliances are amazing. It looks space age robot stuff.
Both his hips, both his knees done, and then walked out twice.
Nice.
Yeah, but that's, what you can get nowadays.
That's pretty amazing. As long as he keeps using it.
That's what they made him walk out.
Yeah. You don't, if you know anybody who's getting replacements, you don't wanna get a replacement and then, oh, it hurts to walk, I'm just gonna sit and do nothing, oh, it hurts too much, don't use it. You have to, otherwise it's not gonna take, it's not gonna work very well, you're gonna be in pain. Whenever you have some kind of orthopedic surgery, anything like that, follow the directions, do the PT, physical therapy, otherwise it's a waste. All right, so questions about fracture repair? Everybody all right? Homeostatic imbalances. Remember, homeostatic imbalances is a good place for a test question or two. I told you that already, right? Osteomalacia and rickets are kind of the same thing. Osteomalacia and rickets are kind of the same thing. Yeah, soft bones. Osteomalacia is in adults. Rickets is in children. There is a reduced deposition of calcium salts in both of those cases. There is a reduced deposition. There's fewer, less calcium salt being put into the bone. This can be for a couple of reasons. Very often, especially in children, it's malnutrition. Especially in children with rickets, it's malnutrition. They call it rickets because their legs are kind of rickety looking. They kind of feel like this, spread out. Because the bones are soft, there's not enough calcium in there, they're just kind of soft and floppy. And what they'll do in that case is, if they're in a place where there's a healthcare system, they'll give them vitamin D to help absorb more calcium, make sure they're getting enough calcium in their diet. That is why we put vitamin D in milk. Where do we get vitamin D from? What organ makes vitamin D or activates vitamin D? Skin, yeah. Sunlight on your skin activates vitamin D. Vitamin D helps you absorb calcium through your GI tract. So if you eat a cheese sandwich and drink a glass of milk and don't have any vitamin D, it's not gonna help you. But if you have vitamin D, you can absorb that calcium, which is why we put vitamin D in milk. Go to the store, bless you, see it says vitamin D milk. It doesn't come that way from the cow. We add vitamin D to help you absorb calcium in your diet. And I think I told you guys this. Where do they get the vitamin D from that they put in the milk?
The cow skin?
Yeah, cow skins. The cows that they kill for your Mac Shack hamburgers, they take the skins and they chemically treat it and squeeze it and get vitamin D juice out of it and put that in your milk. So when you drink vitamin D milk, it's got a drop of cow skin juice in it. For the best. Osteoporosis is when you're resorbing more bone than you're depositing. Osteoporosis is when you're resorbing more bone than you're depositing. Your bone gradually gets weaker and weaker, you have less and less bone. Because it gets weaker and weaker. This is a problem in older people, especially females. Males produce testosterone their whole life. Testosterone contributes to increased bone mass. Females stop producing estrogen and progesterone, I don't know, 50s, 60s, whenever menopause hits. That lack of hormone will reduce the amount of bone being deposited. How many guys know somebody who fell and broke their hip? An older person who fell and broke their hip. Probably not how it happened. They probably broke their hip. It snapped the head off of their femur. You know, the head of the femur and the neck of the femur, that snapped. And of course now that's broken, so they fall down. That's oftentimes what happens in the elderly with osteoporosis. So if you want to keep that from happening to your grandma, take her for a walk. Get her out of the house, get her off the couch, go take her for a walk, go walk the mall or something. Get her active, get her doing stuff. Because remember, mechanical stress makes bones stronger. So keep her active, keep doing stuff with her. She'll like it too. Paget's disease, or if you want to be French, Paget, I think it's Paget's. That's a disease where excess bone is deposited. You're making too much bone. Paget's disease, you make too much bone. And you actually make more spongy bone than compact bone. Make more spongy bone than compact bone. And that new bone gets deposited in weird places. That new bone gets deposited in weird places. Sometimes it'll be between muscles. When you flex your muscle, the bone breaks. Not a nice thing to have. Integration with other systems. We talked about this. Page 196, take a look at that. And that's the bone chapter. That's the bone chapter. Now take a look at chapter 7 in your book. Just open it up, page 200. 99, 200. You don't have to worry about chapter 7. Because we're doing this in lab. This is just name and bone. Alright? However, this is a nice resource. There's pretty pictures in there. Help you study for your lab tests. Here in lecture, we are moving on to chapter 8, joints. The joint or articulation is a place where two bones meet. The joint or articulation is a place where two bones meet. And of course, we have to classify these. We have to classify or categorize these. Because there's different kind of joints all through your body. There's different kind of joints all through your body. If you look at your notes for chapter 8, we see functional classifications and structural classifications of joints. A functional classification is how it works. Functional classification is how it works. A structural classification is what it's made of. A structural classification is what it's made of. Keep that in mind as we talk about these guys. Also keep in mind that this is going to be your do-it quiz. And there's going to be several test questions about this. And there's going to be several lab questions about this. All right? I'm going to make you do this chart as a do-it quiz because I want you to be able to reproduce it on your test paper in here and your test paper in lab. I let you guys do brain dumps. You guys know what a brain dump is, right? You walk in, I hand you the test, and you rate whatever you want on it. I'm totally cool with that. You can brain dump this chart on your lecture test. You can brain dump this chart on your lab answer sheet. All right? That's why this is going to be your do-it quiz when you come back on Monday. Everybody with me? All right. I call this sad face. You might want to get out your very own sheet of paper. Sad face, S-A-D-S-E-S. Sad faces, right? The sad is synarthrosis. Amphiarthrosis. Diarthrosis. In your notes, it's synarthroses, endarthroses, and diarthroses. That's plural. The ES is plural. The IS is singular. So before we go any further, let's talk about what these are. What those words mean. A Synarthrosis is a joint that does not move. Remember, this is a functional classification. Synarthrosis is a joint that doesn't move, no matter how hard you push on it. A good example of a synarthrosis would be a suture in your skull. You guys all remember sutures from lab, right? Where the two bones come together? If you fracture your skull, it's probably not going to be at the suture, it's probably going to be somewhere else. Sutures are really strong and they don't hurt. An amphiarthrosis is a joint that moves a little bit if you push on it. An amphiarthrosis is a joint that moves a little bit if you push on it.
One example,
Distal joint between your radius and your ulna. I'll put this up here again, but everybody hold your hand up like this and move your hand around. What bone is on this side?
radius,
Radius. What bone's on this side?
ulna,
Radius and ulna come together, and these are where the carpals are, right?
yes.
Between the carpals and the radius and ulna, you can kind of feel the radius and ulna moving just a little bit. The carpals are doing all kinds of stuff, but these two bones are doing just a little bit of movement. That's an amphiarthrosis. Another amphiarthrosis. Oh, no, never mind. That'll work for now. A diarthrosis is a freely movable joint. A diarthrosis is a joint that's freely movable. What does freely movable mean? Hold your hand up like this. Everybody wiggle your fingers. Wiggle, wiggle, wiggle. Everything that's moving, that's a freely movable joint. Those are all diarthroses. Alright? On your Do It quiz, in order to get full credit, you have to write functional categories. So you know those are functional. As I ask you, what's a functional category of this joint? What's the structural category of this joint? So you have to know which is which. Does that make sense to everybody? You doing okay? Since we're writing functional there, let's write structural here. Those are structural categories. Structural categories describe what the joint's made out of. Structural categories describe what the joint's made out of. Take a wild guess. Tell me what fibrous joints are made out of. Fibers. Fibrous joints are made out of fibers. C is for cartilaginous. Take a wild guess and tell me what cartilaginous joints are made out of. Cartilage. Cartilaginous joints are made out of cartilage. That stands for synovial. Take a wild guess and tell me what synovial joints are made out of.
Synovial fluid,
Synovials.
no,
Now,
no,
synovial joints are pretty complex. There's a lot of stuff going on. Okay, there's a more complex structure. For right now, we're just going to call them synovial joints. So every one of the joints that moves freely is synovial. Alright? So those those are the functional and structural classifications. Now we can use this grid here as a matrix to see what kinds of joints go where, what kind of joints go in which box. We're gonna start off, I'm gonna simplify things a whole lot. 9 squares is too many to remember. If you can think about it and move it, it goes in that box. If you can think about it and move it, every one of those joints that was moving when you were wiggling your fingers are synovial joints, and they're categorized as diarthroses, they're diarthrotic, freely movable. There is no such thing as a joint made of cartilage that's freely movable. There is no such thing as a joint made of fibers that's freely movable, so put X's in those boxes. There's no such thing as a synovial joint that doesn't move a lot, and there's no such thing as a synovial joint that doesn't move at all. So put X's in those boxes. That looks a little easier, right? We talked about sutures before. Sutures are made of fibers and are synarthroses, so they go in that box. All sutures are made of fibers and they don't move. All sutures are made of fibers and they don't move. Now here's a weird one. Kind of a fun name, but still kind of weird too. Gomphosis. Do you all have gomphoses? All of you? Maybe. Gomphosis is a joint this tooth makes in the socket of either your mandible or your maxilla. So if you have teeth, you have gomphoses. There are people without them. I see people without any teeth with a little face, they tuck their lips in. It's not really hard. It's kind of scary, but a gomphosis is literally a pagan socket joint where the tooth fits down into the alveolus or the pocket of the jawbone. Take a look at page 252. Do you want a gomphosis that's amphiarthrotic? Do you want to have wiggly teeth? No. So it's good when they're synarthrotic, when they're synarthroses. They don't move. If you got wiggly teeth, go to the dentist. And then there's a syndesmosis. Syndesmosis. Syndesmosis is a joint made of fibers. Syndesmosis is a joint made of fibers. Fancy word for ligament. a fancy word for a ligament, syndesmosis, made of fiber. What's the difference between a ligament and a tendon? You know this.
The ligament tied to bones.
Ligaments bone to bone, tendons bone to muscle. It's a ligament, syndesmosis. Why did I draw it in between those two boxes? Yeah, some don't move at all, some move a little bit. The joint between your tibia and your fibula, down by your foot, it's a ligament. And that's not moving. Otherwise, it'd be pretty wobbly when you try to walk. So that is a syndesmosis. It's synerphrotic. It doesn't move. Up here, we have the distal radius and ulna joint. That's what I had you doing here. You can feel it kind of moving just a little bit. It'll kind of do this. A little bit, moving stuff around. So that's still a syndesmosis, that's still held together with ligaments, but it's amphiarthrotic, it moves a little bit if you push on it. How are we, okay? So we're down to cartilage. Symphysis. Symphyses is plural. A symphysis is a joint made of cartilage, and it includes your intervertebral discs and your pubic symphysis. It includes your intervertebral discs and your pubic symphysis. Now, your intervertebral discs will move a little bit. If you bend over, I'll kind of squish over a little bit. The pubic symphysis is a joint that joins your coxal bones together in front. Remember the two pubic bones? In front of the coxal bone, ilium, ischium, pubis. Where the two of them come together, there's a pad of fiber cartilage. That's a pubic symphysis. How is that amphiarthrotic? Only under certain conditions. Yes. When a woman is pregnant, towards the end of the 8th month, beginning of the 9th month, she starts to produce hormones like relaxin. Relaxin will soften up the pubic symphysis and give it a little bit of give. Also loosens up the sacroiliac joint. If you've ever had a baby, you might have realized that the last couple of weeks it feels kind of loosey-goosey here, like it's loosening up a little bit. That is because baby has to come through the birth canal. So you don't want this tight, you want it loose. We are on the very edge of not being able to get our babies out because they're almost too big to fit through the birth canal. The more C-sections we do, the more that's going to happen. Now, we're not quite to the point of bulldogs yet. If you have a purebred bulldog, you're not going to have natural birth. You have to do a C-section. Their heads are too big to fit through the birth canal. Mom will die. Babies won't come out. That's how much we've messed with those dogs. By the way, this is purely a personal viewpoint. If you want a dog, awesome. Get one from a pound. Don't pay these people $2,000, $3,000, $4,000, $5,000 for, oh, I want a cocker schnoodle poo because it's the cool dog this week. Get a pound puppy. That pound puppy will love you forever. and don't support these people who are breeding inbred, broken, mistreated little dogs. Sorry, that's a personal pet peeve of mine. I try to pick a wall. We've genetically engineered some breeds of dogs to the point where they have continual problems their whole lives. Some of the bulldogs, their noses are so flat and smashed in, they can't breathe through their nose, they have all kinds of problems, hip dysplasia, tooth problems. Anyway, I'll get off the soapbox, I apologize. Human symphysis gets mushy when you're having a baby. All right, one left to go. Synchondroses. It's got our cartilage word, C-H-O-N-D. Take a wild guess, tell me what this is made of. Cartilage. And this can also be either synarthrotic or amphiarthrotic. Synarthrotic or amphiarthrotic. By the way, this is fibrocartilage. The symphyses are fibrocartilage. Synchondroses are hyaline cartilage. Synchondroses are hyaline cartilage. A synchondrosis that does not move is an epiphyseal plate. A synchondrosis that does not move is an epiphyseal plate, not moving. If you move it, you break it. Another one is between your first rib and your sternum. Another synchondrosis is between your first rib and your sternum. The amphiarthrotic amphiarthrotic synchondrosis would be ribs 2 through 7. And the sternum. Ribs 2 through 7 and the sternum. CPR works because of that. CPR works. Now understand that there are synovial joints between the ribs and the cartilage and the sternum. There's actually synovial joints there. But when you're wailing away on that, you're bending those cartilage ribs too. If you're doing it right. If you're doing it right, you're cracking ribs. CPR. But those costal cartilages are bending under pressure. So a synchondrosis can be synarthrotic or amphiarthrotic. I think that's it. That's your do it quiz for next class. If you want to take a picture, go ahead. You got to have everything that's up there to get full credit. Everything that's up there to get full credit. How many of you guys drew this along with me? You guys are doing it right. Because that drawing, as well as just taking a picture, will help get that into your brain. that will help you learn it. If you draw that by yourself, get a separate blank sheet of paper and try and draw it from memory 10 times, by the 10th time, this will be engraved in your brain. And you'll be able to brain dump it on the next test, the next lab practical, probably the final too. So, learn this. All right? General structure of a synovial joint. Take a look at page 254. I don't know, it's almost spring break, you guys feel like screwing off the last part of class?
Yes.
Yeah.
We're gonna do a little crash course.
I am so glad that you guys are not 5 years old. If you were all in, like, kindergarten, the only way I could teach you about your skeletal system would be to sing you that stupid song. You know, the toe bone's connected to the foot bone, the foot bone's connected to the ankle bone, the ankle bone's connected to the leg bone. Like, apparently there's one leg bone. For the purposes of teaching college-level anatomy and physiology, let's just say that that song is reductive, insufficient. For that song to be at all useful for remembering all 206 bones that make up your skeletal structure, it would have to begin with something like the distal phalanx is connected to the middle phalanx, and then end with something like the frontal bone meets the parietal bone along the coronal suture, and it would probably take like 2.5 hours to sing the whole thing. But there is way more to know about your skeletal system than just the names of the bones. In addition to bones, there's cartilage and fibrous connective tissue that allows them to work together, and maybe more importantly, if you're going to talk about the physiology of your skeleton, you have to talk about joints. Joints are the meeting places between two or more bones, and even though it might not sound mathematically possible, you actually have more joints in your body than you have bones. In a lot of places, like your hands and feet, each individual bone is part of more than one or two joints. And then there's the matter of what all that bone, cartilage, connective tissue, and the joints that they form actually work together to do. And that is move. Body movements happen when muscles contract across joints, moving one bone toward another, and studying the different types of movements your body is capable of is not only pretty fun, it's also one of the best practical ways to understand your bones and joints. If you ask me, all that is infinitely more interesting than memorizing what goes where and pretending like a backbone is really an anatomical structure. So, aren't you glad you're a grown-up? Don't worry, it's not anyone you knew. It's plastic, and it's a little bit smaller than the average adult skeleton, but other than having me stand in front of a giant x-ray machine for 10 straight minutes, I can't think of a better way to walk you through the major anatomical structures of your skeleton. Now, if you managed to retain our introduction to human bones last week, you'll recall that anatomists typically divide the skeleton into two major parts, the axial and the appendicular. The axial structure includes all 80 midline bones that form your skull, vertebral column, and thoracic cage. Starting at the top here, your skull's 8 cranial and 14 facial bones form your body's most complex bony structure, coming together to do some pretty great things like protect your brain, help you see, smell, hear, eat, and, have a face. The 33 irregular bones in your vertebral column start with your atlas vertebra, the one that holds up your skull and is named for the Greek god Atlas, who held the world on his shoulders as a punishment. I'm not saying you got a huge head or anything, I'm just saying that's what it's called. The vertebrae run down from your skull to your pelvis, providing the central support for your upper body and completing the enormously important job of protecting your spinal cord, the main communication line between nearly all of your body and your brain. Most of your vital organs are protected by the 12 pairs of ribs and dagger-like sternum that together comprise your thoracic cage, which also provides attachment points for your back, chest, shoulder, and neck muscles. Now, the appendicular skeleton includes your upper and lower limb appendages and pectoral and pelvic girdles, muscles that attach to the axial skeleton at the shoulder and the thigh. And even though your arms and legs clearly serve different functions, unless you spend a lot of time walking around on your hands or picking stuff up with your feet, both sets of limbs share a similar setup. They're each composed of 3 major segments, a common arrangement we see in loads of animals all the way back to fish, which anatomists refer to as 1 bone, 2 bones, lots of bones and digits. We can't all be Dr. Seuss. And that's just about enough anatomy for this plastic skeleton. The paper itself, I'd rather focus on the physiology of the skeleton, and in order to do that, we gotta talk about joints. As is often the case in anatomy, we classify joints both by what they're made of and by what they do. Because form follows function, we can't really talk about one without talking about the other. So the structural classification of your bones is all about what kind of material binds those bones together. Like, is it a fibrous tissue or cartilage or a special fluid-filled joint cavity? But the functional classification focuses on how much that joint can move. So for example, you have joints in your body that don't move at all. These include, say, the joints between the bones that make up your cranium. These non-moving joints are called synarthroses. But you also have joints that move only slightly, like the spot where your 2 pubic bones meet to form your pelvis. That joint exists mainly to absorb shock from walking and running, but it also is proven very handy during things like childbirth. These partly moving joints are called amphiarthroses. Finally, there are the diarthroses, which are fully movable, like your classic knee and elbow joints. They're mostly found in your limbs. But if you eventually find yourself in the business of examining and treating people's joints, and there are a lot of doctors who do, then it'll be especially useful to know the structural classifications. Structurally speaking, you've got fibrous, cartilaginous, and synovial joints. Fibrous joints connect bones with dense fibrous connective tissue and are mostly immovable, like those sutures between your skull bones. As you might guess, your cartilaginous joints unite bones using cartilage and are similar to their fibrous brethren in that they don't move very much and they lack a joint cavity. But the family of joints that make all the sports and the entire art of breakdancing and yoga possible are the freely movable synovial joints. Most joints in your body fall into this category. Although they do make use of cartilage and fibrous connective tissues like ligaments, they're different in that the bones they join are separated by a fluid-filled joint cavity. The cool thing about these cavities is that they contain a bit of viscous, egg white-like synovial fluid that acts like grease on a hinge. Without that lubricant, just running down the street could cause enough friction not only to wear out your joint surfaces, but actually overheat your joints enough to essentially cook the surrounding tissue and leave your legs smoking like a desperate Looney Tunes character. These freely movable synovial joints come in 6 different configurations that together allow pretty much any movement your body can make, from a subtle head nod to a vigorous jumping jack, all of which you will find in action at your typical dance party. Seriously though, dance parties are an excellent place to study skeletal physiology. I mean, let's just take this from my perspective. I'm at my high school prom. I'm wearing a tux that is really uncomfortable, and I'm feeling kind of shy standing on the edge of the crowd. So if you want to test the waters out a little bit with a little hand dancing, just a hand going. Wave my hand from side to side. It's a type of gliding movement, one that occurs when one flat bone surface glides over another. All these motions use gliding or plane joints, like the one between the distal ends of your radius and ulna and the carpal bones of your wrist. But say after a while, I feel like these gliding movements just aren't enough to fully express myself. I have to enlist the more versatile angular movements. These are the types of motion that either increase or decrease the angle between 2 bones across any plane in the body. Like if I bob my head or kick my leg up or raise the roof, if people still do that. If that bending motion decreases the angle of the joint and brings those bones together, like when I bend my arm together, that movement is called flexion. When I bend it back, I'm increasing that angle, and it's called extension. And if I continue that motion beyond my normal anatomical positioning, and it's somewhat dangerous, that is called hyperextension. These motions enlist the hinge joint. Similarly, my oval-shaped condylar knuckle joints allow my fingers to bend and ball up for a good fist pump. Now I'm getting super into it. I might raise my arms up over my head, while the act of raising my arms away from my body is called abduction, while moving them back down toward the body is called adduction. And this here like lasso movement, that's circumduction, a combination of all 5 of those movements that allow the forearm to move in a circle while the elbow joint stays relatively stable, which really makes you want to give credit to those cowboys. Now if you want to get really serious about that lassoing and expand it to include the entire arm, the move eventually will morph from an angular movement to a rotational one, a motion that turns the bone around its axis, in this case, the humerus. Hip and shoulder joints use a ball and socket design that allow rotational movement, but the more flexible a joint is, the more unstable and fragile it is, which is one reason why you see so many dislocated shoulders and hip replacements. And it's worth pointing out that some movements are just special and unique and weird and only occur in a few select joints, especially in your hands, feet, and jaw. For example, your ability to touch your thumb to your fingertips or give a thumbs up is thanks to opposition movement facilitated by your saddle joint, which makes your thumbs opposable. The pivot joint between your radius medius and ulna allow you to rotate your palm forward or anteriorly in a motion called supination, and turning it backward or posteriorly is called pronation. So that's what I like to think is the more grown-up approach to teaching you about your skeleton. It did not involve any singing, but yes, a little dancing. And it was worth it because you learned about the basic structure of your skeletal system, including the arrangements of both the axial and the appendicular skeleton, and we were...
Crash course. You guys realizing that you kind of like that is pretty cool. Crash course is worth watching over and over. It will help you. Questions? Just like this. Yeah, just like that. That's your Jewish quiz on Monday. More questions? Yeah, not Monday, spring break. Monday after you come back from spring break. All right, everybody good? Do not get arrested over spring break. Don't let me